As everyone is aware, we are in the second wave. COVID is not only in our community, but we're seeing it more and more over the last several weeks at Covenant. It's imperative that we double down on the things that we know help to prevent the spread of the disease. We're doing things like increasing our cleaning and sanitation throughout the hospital. We're trying to isolate COVID patients from non-COVID patients. But that's not enough. We have to do the things that we know help to stop the spread of the disease. Things like wearing our masks. Mask wearing has been shown to reduce the risk of spread of the disease, and it's imperative that everyone does this. Increasing our hand hygiene. If you stop to think, should I wash my hands? Just go ahead and do it. It's something that, again, can stop the spread of the disease. We need to be vigilant about our social distancing, not only here in the hospital, but also at home. To that effect, we've changed our visitor policy, restricting visitor to just a few exceptions. Again, as the spread of the disease is in our community, we want to minimize that risk of people bringing it into our community. Social distancing is important, not only on the floors and with our patients, but also throughout the hospital. So places like break rooms and the cafeteria. Again, we need to not let our guard down to really fight the spread of this disease. And then another thing that we can do is to prevent large gatherings. So not having large meetings within the hospital, keeping it to 1 or 2 people in a group. It's going to become even more important over the next couple of months as we get into the holidays. So with Thanksgiving and Christmas, we all want to be with family. We all want to spend these special times together. But this is the year that we have to be doubly vigilant again, and prevent ourselves from gathering in large groups, from gathering with people that are coming from places that are not our immediate family. It's certainly a trying time, it's certainly sacrifices, but these are the things that we know that can flatten the curve. And especially important to us as healthcare workers, this extends beyond the walls of our hospital. It's not just things that we need to do here at Covenant, it's things that we need to do when we go home to our families, we go home to our friends. These are the things that are going to help stop the spread of the disease throughout our community, not just here at Covenant. Covenant's doing everything that we can to keep both our patients safe, our community safe, our visitors, as well as our staff and employees. Things like increased sanitizing and cleaning of our surfaces throughout the hospital. Really trying to double down on mask wearing and using appropriate protective equipment. Things like changing our visitor policy to restrict our visitors and the potential risk of spread from our community. We're trying to not only take care of our COVID population, but also our non-COVID population. Through the summer, we've seen a robust increase in the number of patients seeking care, not only with COVID, but the non-COVID population. We're trying to treat those patients appropriately to keep our community healthy and safe. Obviously, that puts a strain on all of us. But again, we want to be able to treat those that need care. We all saw the negative effects that happened in the spring when we weren't able to take care of that non-COVID population. By delaying care, it puts patients at risk, and they tend to come into the hospital sicker. We're trying to avoid doing that. Things like smoothing our surgical scheduling to balance when we bring patients into the hospital and when we have appropriate resources. So these are all things that we're doing to try and do this here at Covenant. But again, one of the most important things that we can do is to stop the spread of the disease in the community. That will reduce the number of patients coming to Covenant. Therefore, again, mask wearing and hand hygiene and avoiding large crowds and gatherings and using appropriate social distancing measures. These are all things that if we can reduce the disease in our community are going to help us here at Covenant and allow us to give patients the care that they need.